In this video, we will go over how to set up a sterile field for cataract surgery. Before you begin, apply hand antiseptic. First, clean the back table with a hospital-grade disinfectant wearing gloves to protect the hands. Once the surface is dry, open the surgical pack. The outside of the pack is non-sterile. Lay it on the table with the label facing towards you. Tear the label open and unfold surgical pack long ways across the table. If a sterile prep kit is included, remove and hand off to the circulator. The surface of the back table is a sterile area. Unfold the back table cover below the top of the table, keeping a minimum distance of 6 inches from the sterile area. Before opening a sterile pack, it is important to verify the information on the label: instrument name, the date that it was autoclaved, the initials of who autoclaved it, and which autoclave was used. Then check the sterile indicator to ensure the instrument has been sterilized. The packaging also has an indicator on the surface that will be dark colored if it has been autoclaved and light colored if it has not been autoclaved. Lastly, look over the package to ensure that there are no rips or tears and that the package is intact. Open the sterile pack by pulling apart the 2 tabs at the top of the package. Flip the item onto the sterile field. Wrapped instruments have 3 seals. Place finger inside pouch, pull tab out to break the front seals, then pull back to open the top seal. Fold the material back and around to the hand that is holding the instruments to create a sterile glove for your unsterile hand. Then place the instruments on the sterile field. Sterile area to sterile area. Repeat the process with all supplies. Once all of the instruments are opened, you are ready to scrub in. Before setting up the instruments, you must first perform the surgical hand scrub, starting at the top of your hand and working your way down. Then gown and glove. When preparing the back table for surgery, it is important to place the instruments in the order in which they will be used. First, unpack all of the miscellaneous supplies and double check that nothing is missing. In this demonstration, we are placing the items in the order of a typical lens replacement surgery. First, the surgeon is gowned and gloved. Next, the drape is placed over the patient using tegaderm to hold in place. Cut the tegaderm according to your surgeon's preference and place on the table. The drape is placed on top of the tegaderm as the drape will be used first. Next, place the instruments in the order that they will be used during the procedure. The eye is opened with the speculum. BSS is applied to the cornea. The surgical assistant hands the scope handles to the surgeon. The globe is fixated with the forceps. Next, paracentesis blade is used. Lidocaine is inserted, then viscoelastic. Then the primary incision is made with the keratome blade. The cystotome is used to nick the capsule to begin the capsulorhexis. The utrata is used to perform the capsulorhexis, followed by hydrodissection. Then the phaco handpiece is used to remove the cataract. The second hand instrument is typically used to manipulate the lens. Then the INA is used to clean up the cortex. The lens will be inserted with the lens injector. The lens manipulator is used along with the INA to remove any remaining viscoelastic. Lastly, the pressure is checked and the wound is sealed with BSS and Weck-Cel sponges. It is important that sterile water is on the back table and clearly labeled. Notice that the circulator is at least 6 inches from the bowl in order not to contaminate it. Water is toxic to the eye. The water is only used for instruments after they have been used. The 1-inch parameter around the surface of the table is where the sterile area begins. Inside the parameter is considered the sterile area. Anything that crosses over into the sterile area must be sterile. To maintain a sterile field, it is important to keep your hands where you can see them, below your shoulders and above the waist. Your hands must stay in that area on the table or within the sterile area of the patient.
you.